Kia ora, nurses, and welcome back to Nurse Know-How. Today, we're taking you through the essential steps for nurses from overseas who dream of working in the beautiful Aotearoa, New Zealand. 5 steps to get registered by the Nursing Council of New Zealand, NCNZ. The NCNZ is the organization that ensures nurses in New Zealand are safe, competent, and prepared to work in our health system. So, let's break down the process together. Step 1. Document verification with CGFNS. Starting off at Step 1, you need to send your identity, education, registration, and licensure documents to a company called CGFNS, which will check if they are valid and authentic. In Nursing Council website, the necessary documents are listed. Make sure you meet the requirements before submitting to avoid delays. If you are from a nation where English is not the first language, you are required to submit your English test results from either OET or IELTS. If you're educated or registered from a country where English is first language, there is a different pathway which is explained in the website. It is important that you apply to CGFNS after you have achieved the required 2,500 clinical practice hours or at least 2 years post-registration experience. More clinical hours experience, the better. Remember, this process may take a few months, so kickstart this journey as soon as you can. Step 2. Application to NCNZ. Moving on to Step 2, after CGFNS verifies your documents, you can apply for registration with the NCNZ. You need to fill out an online form, pay fees, and upload documents, such as your passport, CV, police clearance, and English test results. The NCNZ will then assess your qualifications. If you hold current registration in the UK, Ireland, Ontario, British Columbia, Singapore, or the USA, you may not be required to undertake the Competence Assessment Program or CAP. The CAP prepares overseas nurses for the nursing role and healthcare context of New Zealand, which is different to many other countries. The program may take from 6 to 12 weeks, depending on the provider and the availability of placements. NCNZ will advise you if you need to do this after they assess your application. Step 3. Applying for CAP. Step 3 comes into play if you need the CAP. You need to apply for a place in a CAP provider, such as a university, polytechnic, or private institution. You need to pay the course fees, which may vary depending on the provider and the location. You may also be eligible for some funding assistance from the government if you meet the criteria and apply online. Step 4. Visa application. Once you're offered a place from a CAP provider, you need to apply for a visa to enter and work in New Zealand. You can apply for a visitor visa, which allows you to stay in New Zealand for up to 3 months to complete your registration or CAP. You need to provide evidence your offer of place, your course fees receipt, and your travel and health insurance. Or, you can apply for a work visa, which allows you to stay in New Zealand for up to 12 months to work for a specific employer who has offered you a job. Step 5. Commencing work in New Zealand. Once you have completed your registration or CAP, you can now start looking for a job as a nurse and obtain a work visa. You need to renew your practicing certificate every year, and complete the required continuing professional development activities. You also need to maintain your visa status, and apply for a new visa or a residence permit if you want to stay longer in New Zealand. And there you have it, nurses. The essential guide on how to make your nursing dreams a reality in New Zealand. If you've got questions, drop them in the comments below. Don't forget to hit that like button, subscribe to Nurse Know-How, and stay tuned for more valuable content. Ngā mihi nui.